Hi, welcome back to the new norm. I think this is going to be our official studio, I think for a few months, finally done, so to speak. This is brought to you by Midway Dental and Catapult Education, and I'm Dr. Lou Graham. Today I'm going to be joined by our second true expert on OSHA. Tracy Whale did an amazing job. And today I'm going to be talking with Dr. Karson Carpenter. Okay, that all being said, yesterday in the news on NPR, the head of the CDC, and I want to get this absolutely right, Dr. Robert Redfield was interviewed. And I think it was quite interesting what his comments were. And I think those comments will relate well to Karson going well into CDC guidelines. But what I kind of found really interesting were a couple key points. First key point that he brought up was that 25% of the people who have contacted the COVID virus that would be positive have been totally asymptomatic, and they are carriers. So they are contagious to a point. He also went on to say that those that develop symptoms for the previous 48 hours, they are symptomless free, but they are absolutely carriers as they shed the COVID virus from their oropharynx. So this again is why I think this is so imperative we're talking with Karson on this. So here you are as a dentist, you are in the front line now because we're going to be talking about how to shield ourselves from the oropharynx on these asymptomatic patients. And so I think this becomes absolutely essential. We'll get more into some of the details about that interview in our next segment. But what I also think is very interesting is the CDC is heavily looking into whether we should all be wearing masks, not N95 masks, but masks when we're out socially. And when I say out socially, we're not out socially, but we're going to the supermarket, we're going to the gas station, whatever we're doing for the essential visits. So not social, but essential visits. With that, the other last thing I would comment on is that he did go into that we have 99% recovery once you get the disease. So we want to continue to emphasize this is recoverable. He feels we will win, but he talks about up to 24 months until a vaccine is coming that we're going to be in this new norm without a doubt. He says the number one weapon against the virus is social distancing. And I can only tell you that's what we must be doing and continue to do. So with that, I want to bring on Dr. Karson Carpenter. He's a dentist out of Michigan. His wife's a dentist, and he's the president of the Compliance Training Partner Corporation. He travels all over the country teaching OSHA, and I'm really happy to have him join us. And we're going to get into a lot on these next couple segments, if you ask me. So, Karson, first question. Do you see the new norm lasting well beyond, we'll say, 1 and 2 months?
You know, Lou, I really do. It's hard to say exactly what the new norm is going to be because this is also new. New things are coming out almost daily. But yes, the new norm is going to go on much longer than several months. Maybe after a couple of months, we'll be able to relax some things, but I believe that we're never going to be able to practice dentistry exactly the way we have in the past.
And with that said, do you think dentistry pre-2020 will be the old norm and there will be an entirely new norm, so to speak, that we as dentists will be practicing?
Well, you know, I do. I think it's going to be different, but let's start with the first thing we need to do is follow the existing rules.
Yes.
I think what we're going to see is
Okay.
people are going to be upping their game following CDC guidelines as they should, following OSHA regulations as they should, advocating things we've been talking about for years, the annual OSHA training,
Right.
Initial training of staff. But the new norm, they're going to have to up their game. We're going to have to take more precautions. We're going to have to screen patients more. We may not be able to see as many patients because we don't want to have as many people in our facility at a time as we did before. We're probably going to have more time between patients to properly take care of a room, to disinfect it and clean it as we should.
So let's break all this down into specific components. And based on the fact, Karson, that here the CDC is saying 25% of all positive testing patients are asymptomatic and are potential carriers then for those 14 days or whenever they are shedding the virus. Let's talk about then new screening opportunities versus the old screening opportunities and get into questions. So I'm going to let you start off, and then we're going to go back and forth about key screening questions. Give me some of the ones that doctors should now be asking patients. And I hope everybody takes notes on this. And I think at Midway Dental and Catapult Education, we'll be creating a written correspondence as a guideline to all the doctors out there from these conversations. So let's start, Karson. What should those questions be when we're talking screening?
Well, the first thing we're going to want to do is we're going to want to start that screening process well before the patient even comes into the office. So we're going to want to do this when we call to confirm. We're going to want to ask them, first of all, we're going to want to update medical histories at every visit, because things are changing rapidly.
Right. Yep.
Second, we're going to want to ask those questions. Have you been around someone with a confirmed or suspected case of COVID-19? And we're going to want to dive a little deeper into that. Is anybody in your family displaying any respiratory symptoms? Anybody at work? Have you exhibited any symptoms of respiratory illness? And we are going to have people at the front desk who can communicate well, because people may not always know what those respiratory illness symptoms are. In other words, we need to ask, have you had fever? Have you had cough? Have you had shortness of breath? I think that the question, have you traveled internationally, is probably not necessary anymore, because let's face it, the biggest number of cases is in this country. Also, when they come into that waiting room, okay, and in fact, I'd like to talk a little bit too about how I see people come into that waiting room in a minute. But when they come into that waiting room...
Wait, before you... Yeah. Wait, Karson, let's stick to screening questions, because we'll get into the waiting room, which I don't think will exist. But let's continue with questions. So let me go back. So let's say you're establishing these questions and you ask, on the... Let's just say you send out an email with your questionnaire. And the patient says, the proposed patient says, I have been in a house with someone who's under self-quarantine who's been positive. I personally wouldn't want to see that person in my office until I could test that patient, because now we're also bringing in a potential carrier of this. So let's talk specifically. If someone has been around a person who has been positive, I would say it's essential that they have to be self-quarantined for 14 days before they come into my office. Would you agree or disagree with that?
Oh, I'd absolutely agree. I'd absolutely agree. If they feel, if they've answered positively to those things, they shouldn't be seen in your office. They need to be cleared by their healthcare provider, and that's probably going to involve a COVID-19 test, in my opinion.
Right. Great. So we have that. And is it fair to ask on the questionnaire, have you been practicing social distancing in your home? And please explain, and where they fill it out. I mean, my question is if people are out and about and in states that people are not practicing social distancing, again, I really don't want them in my practice either. I'm trying to create a safe environment. Do you think that's wrong to put on the questionnaire?
No, I don't, and I'll tell you why. I've been teaching OSHA compliance for over
Okay.
30 years, and OSHA is about protecting our
Yep.
staff. And there's what's called the general duty clause, where you
Right.
may have to go over and above and beyond. You have to use common sense here, and we need to do the very things you're talking about to protect ourselves and our employees.
I agree. So these are other questions I'm just going to throw at you in our first segment. Okay. Another question I would want to put on my questionnaire, and I hope people email us more additional questions because we've got to come out with a universal questionnaire. So my next one, when was the last time you were at a social gathering of 10 or more people? I would like to know that. If it was last Tuesday, I would not want that person in my office. What are your thoughts on that question? Just curious.
Well, my thoughts, Lou, are this. I mean, as we go forward, we're going to get through this someday. When we get through this, I don't think
course.
that's going to be necessary. But during this COVID-19 pandemic, during
Right.
this phase in our
Right.
country where things are accelerating, absolutely, those type of questions need to be asked. At one time, they may have been considered intrusive or a violation of privacy standards,
Right.
but they're not. That's to protect all of us.
I'm with you. So other questions that, and for our listeners, I'm just going to read. Have you been to a long-term care facility recently? And I think that's interesting because yesterday, Dr. Redfield from the CDC said we have now up to 400 contaminated facilities. So I would also want to know, have you been to a facility like that within the last 2 weeks? I know, I agree with you. I think these are transient questions and the documents will change. But I openly think the more questions we ask and facilitate based on the current pandemic are really important. And that's just how I look at it. Anything else that you would want on that questionnaire right now? I'm just curious, Karson.
No. I mean, I think you've covered the basic things, but I will tell you that again, it's up to us to protect our employees. And for example, you, Lou, you have those questions. If you feel that you should be asking those, absolutely, you should be asking those questions. It's up to us because the guidelines have not yet caught up with the disease, wouldn't you say?
Oh, absolutely. And I'm just going to put this out there. And if the listeners out there have more questions that they think should be on the questionnaire, I actually want you to email me. And for right now, I'm going to put my email up at lou@catapulteducation.com. I'll be having a midway email address for our next episode. But if you have questions that should be on the questionnaire, I really would love you to forward them to us so that we can come up with some universal questionnaire, at least for the next 2 months. I think the more Karson and I talk about this, on the episode and on the phone, I think there's a need for us all to come at this universally. And it keeps changing, like Karson said. Okay, so the next part of this discussion that will conclude this segment is let's talk about either the waiting room or the non-waiting room experience. And when I say this, what should happen? How should we be conducting that entrance into our office right now, Karson?
Well, I'll tell you how we're doing it and how I suggest doing it.
Okay.
First of all,
Okay.
I think that the so-called waiting room, we shouldn't even have a waiting room, if you will, right now during this emergency situation.
Agreed.
To me, that means that the patient lets you know by cell phone when they arrive in the parking lot, that our assistant
Right.
walks down, gloved assistant, by the way, walks down, opens the door,
Yep.
asks the patient to not touch anything, that he or she will open the doors for them, okay? So they come into the office,
Right.
okay? They should be the only patient in that waiting room. Why even have them sit down? Have them take the temperature,
Agreed.
okay? We've already done the questionnaire, right? They say, again, if everything we asked you in the questionnaire is still the same, yes. Take a temperature. They pass that. Let's put a surgical gown,
Right.
a head cap on them, shoe covers, a mask, and walk them directly into the waiting room. To me, there's no more waiting room. Not to treat a COVID-19
Right.
pandemic emergency. There's no waiting room. Why should there be? In the same way with checkout,
Agreed.
with checkout too. Why should anybody check out physically? That can be done online. That can be done via a phone call. We've got to minimize contact between people in the office and time those patients spend in our office.
So I would say this, and I completely agree. So in my eyes, if we do the proper screening, and now the patient walks into the office and they are put on with a PPE, and maybe, again, if there's a PPE shortage, this could all be discussed, because I agree with you 100% in our initial discussions. I just hope we have the PPEs for patients to provide such. If not, maybe we take off their shoes. I have no idea. I'm all over what you're saying. And then I think, let me just ask you this so we conclude this segment. As the patient walks into the office, prior to putting on a mask, or if they should wear a mask, would we agree that we should at least immediately have them wash their hands, because obviously, or we're putting gloves on them, and they should do a pre-mouth rinse even before sitting in our chair? What do you think?
Oh, well, I absolutely think when they come in that waiting room, besides putting on that gown,
Yep.
ideally a head cap and shoe covers, they need to use alcohol-based hand
Yes.
rub, and then give them a pair of gloves. Why can't they wear gloves when they're in your facility? There's no problem with that in my mind. The mask,
Agreed.
obviously, they have to
Agreed.
pull that down when it comes time for you to examine them in the chair. But no, I think
Right.
those things
Right.
need to be done.
Okay, so thus far in this segment, so we're all clear, I think we have to come up with a universal screening document that is emailed or sent to patients. And it might be at this point a verbal discussion with our front team member to kind of go over those 8 or 10 patients, or 6 or 8 emergency patients who are coming in, to even go over that in this over the next 1 or 2 months, Karson. I just think the more proactive we are in screening before they walk in, I think the better. Would you agree?
Well,
or
I agree
I'm
with
just
that.
curious on your thought.
I
on
agree
that.
with that, Lou. Now, some
Okay.
people might say that my ideas and the ideas you've just expressed here are overkill, over the top, beyond the
Right.
guidelines. But you know
Right.
what?
Right.
I even have a slide in my presentation I call Beyond Standard Precautions. And to me, we need to use common sense, again, because as long as the guidelines and our understanding of the disease lags behind, we need to do things that we're talking about here. I don't think they're over the top. I don't think they're excessive. And it may be that we're saving lives and saving patients by doing so.
Right. Agreed. Okay, so to wrap up this segment, first off, Karson, I'm going to bring you right back for the next segment. I think we've talked screening. I think we've talked about proper entry into our offices. Next, we're going to talk about how we disinfect our offices, what's coming, and proper protocols to see our emergency patients. Karson, thanks for being here, and we're going to see you on the next segment of The New Norm.
You're welcome,
Thanks
Lou.
so
I'll
much.
look forward to doing that with you.
So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.